Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon and I specialize in facial rejuvenation. And it is my pleasure today to talk about a really important topic. This is something I'm actually very, very passionate about, and that is whether or not skincare products that are purchased over the counter or outside of physicians' offices are equivalent or as good as products that are purchased in a physician's office. And as a consumer, what you should be doing, because this topic is obviously very confusing and there's a lot of information and sometimes misinformation, and you really have a hard time understanding what it is you need to do if your goal is to get the best looking skin possible. So let's talk very briefly, just right out of the gates, what makes a product exclusive to a physician's office. So generally speaking, those are things that are, that require prescription. So things like hydroquinone, things like Retin-A. Those two categories, and Retin-A, as you know, is a product that is used to stimulate collagen. It's used to improve the overall tone and texture of the skin. And hydroquinone is a bleaching agent that is used to decrease pigments and sun damage on the skin. Both of them are excellent, excellent products. They definitely work. They've been tried and true, scientifically, medically tested, tons of papers, tons of long-term research about them. They're fantastic. But that is really what makes a product a medical grade product, is the fact that it requires a prescription, generally speaking. Then on the other hand, you have products that can be purchased over the counter without a prescription, and in that category, actually something very similar to Retin-A, you have Retinol. Now Retinol is the over-the-counter version. Both of them are vitamin A derivatives. They can be used really in a very similar sort of fashion. They do the same thing, but one of them is over the counter, one of them is prescription. But I'm going to talk very specifically about Retinol and Retin-A in a moment. And then in the bleaching categories, you have all sorts of non-hydroquinone lightening agents that can be put into products without requiring a prescription. Having said all that, as an individual consumer, the basis of really good long-term improvements to your skin come down to several important factors. Number one is sun protection. That goes whether or not you're going to get your products from a medical office or from over-the-counter sort of environment. If you don't take care of your skin from a sun protection point of view, all of it is for nothing. Second aspect is you need to cleanse the skin properly, because if you don't properly cleanse the skin and remove the dirt, the debris, the things that are going to clog up the pores and the channels in the skin, whatever you put on your skin subsequently isn't going to do a whole lot. Now, the third general philosophy when it comes down to skincare is consistency. Whatever you choose to do, if you're not doing it regularly and consistently over time, you're not going to get real results. Whatever regimen you're on, you're going to ideally want to be on a retinol or a Retin-A product. And I'm going to talk, like I promised, a little bit about each of those. You want to be on a vitamin C for this antioxidant, collagen stimulation, lightening and brightening the skin. We know vitamin C really works, so you want to be on that. Then you've got a bunch of other things that your skin is going to benefit from. It's going to benefit from, things that are going to strengthen the skin barrier to protect it. You're going to benefit from things that are going to moisturize and hydrate the skin. You're going to benefit from things that are going to create an antioxidant environment to decrease the amount of sun exposure and past sun exposure and those effects that it can have on the skin and the DNA that increase the amount of pigmentation and production of discoloration in the skin. And ultimately, you're going to want something that is going to exfoliate the skin, because at the end of the day, as we age, our skin begins to develop more and more layers of dead skin, and as a result, that creates a dullness to the skin. Here is the simple point. Medical grade products, generally speaking, perhaps are more effective and as a result are going to be a little bit more aggressive on the skin. So what my experience has been dealing with and selling and prescribing these medical products for our patients over the last 15 years is that many times people are unable to tolerate the high concentrations of Retin-A, the hydroquinone, the combinations of these things in these products. Sometimes they start them for a little while and they're like, yeah, this is really, making me peel, it's making me red, etc. And then they put it away and then they're back to square one. They're not doing anything. The bottom line is, if you have a particular skin condition, in my opinion, things like melasma or severe hyperpigmentation, if you have those, then you're better off with a medical grade product. Truly, anything in the hyperpigmentation category is better treated with the hydroquinones of the world, and those require prescription, and they're usually purchased in a medical office. Now, if you're looking at just purely anti-aging, which is probably like 95% of the people out there, you can get a retinol over the counter. You can get some type of botanical or non-hydroquinone lighteners. You can get your moisturizers and hydrators. You can get your hyaluronic acids to bring moisture into the skin. You can get niacinamide. You can get a lot of these things over the counter. So the key is again, not to get fixated on which is better. The best skincare regimen is the one that you actually do, and you actually do over the long run. So I want to make that clear. The best skincare regimen is the one you actually do. So don't get too caught up on medical versus non-medical. Now, here's the thing between Retin-A and Retinol. They're both vitamin A derivatives, and basically the fundamental function of them is to work at the DNA level to stimulate the cells in the skin that create collagen, which are the fibroblasts, to stimulate them to build more collagen. And they both do that. Retin-A and Retinol does that. And what they also do is they create a little bit of a peeling environment. There's a micro peeling that goes on with these that helps exfoliate a little bit of the extra layers of skin. And then ultimately what they're going to be doing is stimulating skin turnover and all that kind of stuff. That's why that category of retinols and Retin-As are so important, in my opinion, sort of the foundation of a good anti-aging skincare regimen. Again, I'm not fixated on which direction a person goes with. I generally happen to think that, based on my own experiences, the use of the non-medical product can actually be a little bit more tolerated, therefore allowing you to stick with it longer and more consistently. So I gravitate more and more. In fact, the skincare brand that I developed, KaramMD, is a non-medical level. It doesn't have the concentrations of those products. And the key for that, for me, was I wanted products that individuals can get all the key pieces together, put them all into one product: the vitamin C's, the hyaluronidase, niacinamides, the hyaluronic acids, the lipids, all, peptides, all that stuff, put it all together, make it super easy to use so that you can use it consistently and constantly over time. That's my take on the medical versus non-medical grade products. At the end of the day, none of it is worthwhile if you're not absolutely protecting your skin from the sun, because that is literally the fastest accelerator of skin aging. And what I mean by skin aging is it's thinning the skin by decreasing the amount of collagen and elastin in the skin, and as a result causing more lines and wrinkles, and not to mention the fact that the sun is also the reason why there is discoloration forming into the skin. So the browns and the reds, etc. I hope this helped you guys. I am very, very passionate about these topics. I love sharing these ideas, trying to help simplify and make everything as easy as possible for you all. If you enjoyed what you saw today, please follow along and subscribe to my channel. We produce videos once or twice a week, and comment below. I'm happy to answer any questions you might have, and more importantly, share it with your friends and family who would potentially benefit from this information as well. I hope you enjoyed it, and there's more to come. Thanks again.